Hello and welcome to CGD's 8th annual Birdsall House Conference. This year focused on global childcare and ECD investments and forging a shared agenda on these very important topics. This conference was named after CGD's founding president, Nancy Birdsall, and since its start back in 2015, we've used it as an opportunity to launch and discuss new research on women's economic empowerment and broader gender equality, and foster dialogue on how to harness that research to influence progress in development decision-making. I'm really pleased to be hosting today's event, which will kick off with some opening remarks from senior leaders both at CGD and from our core supporters and partners. Then we'll transition into a series of presentations that will launch new research and also preview work that's forthcoming. And we'll wrap up with a panel that reflects on those research findings and looks towards the future. We'll get into a discussion with representatives from government, civil society, and our own researchers about how we accelerate progress on elevating childcare as a global development priority. For those of you who may have any questions for our speakers, please do drop those into the comment bubble on YouTube if that's where you're watching, or on Twitter or LinkedIn if that's where you're tuning in, or email us at events@cgdev.org. But for now, without further ado, I'm very pleased to introduce Amanda Glassman, the Executive Vice President of CGD, for some reflections.
Thanks a lot, Megan. I'm really excited to be here and to welcome such an illustrious panel of speakers, and thanks to you, the audience, for tuning in. I want to spend a few moments reflecting on why the Center for Global Development has chosen to prioritize this important topic. We've been talking about it for years because of the disconnect, really, between the women's economic empowerment community and the early childhood development community, and really trying to find ways to bring these two ideas together, because we know that supporting children's development and their well-being and enhancing women's participation in economic activity increase economic development overall, reduce poverty, and improve both women's own well-being as well as household well-being. And providing affordable, quality childcare contributes to both. And unfortunately, a lot of the research, advocacy, and policy making relating to childcare occurs in silos. And because of these silos, few policies, programs, or research studies connect the vision of nurturing and caring for children with the vision of encouraging women's employment and economic well-being. We see that we have some kind of a niche here. And our gender team at CGD has been working since 2019 to break through those silos and bring people together across the fields of health, education, and social protection, and other relevant areas to forge a shared agenda. Our 5th annual Birdsall House Conference started us down this road in our research under our COVID-19 Gender and Development Initiative, and its resulting cash, care, and data policy framework deepened this focus. And now we're back 3 years later to take stock of what's been accomplished and what's left to do. Some highlights to note since we last convened around this important topic. Earlier this year, we saw the launch of the World Bank's Invest in Childcare initiative, as well as the first IDA 20, that's the World Bank's concessional financing window for lower income countries. That IDA 20 replenishment included a commitment on childcare for the first time. And these followed the establishment of the Inter-American Development Bank's Early Childhood Development Innovation Fund, as well as the creation of a Global Alliance for Care, which came out of the 2021 Generation Equality Forum. CGD fellows have worked to do rigorous research and develop evidence-based policy recommendations to advise and strengthen these efforts in partnership with many of the people participating in our panel today. And on the topic of partnership, I think we're really glad and grateful for the support of the Hewlett Foundation and the Bill and Melinda Gates Foundation for supporting our work on childcare and women's economic empowerment. And with that, I'll pass the microphone to Greta Bull, who's the Gates Foundation's Director for Women's Economic Empowerment. Thank you.
Thanks so much, Amanda, and good morning to everybody on the phone, on the Zoom, whatever we call these things these days. And thank you for inviting me to join for this morning's session. I am absolutely delighted to help kick off this timely discussion on the importance of childcare, not only to early childhood development, but also to women's economic empowerment. It's really great to see these two conversations coming together. This is a personal issue for me and probably for most of the women in this room, virtual room. I juggled 2 small kids and a full-time job in the UK back in the 2000s, and it wasn't pretty. I was lucky enough to be able to afford private childcare, and I also benefited from having a very supportive spouse. Others are not so lucky. I'm struck by how often I hear that childcare isn't the same kind of concern for lower income women in emerging markets, so that we're imposing our views of childcare on women who live in very different contexts. Let me tell you, I just came back from extended travel in Africa and India, and literally everywhere I went, childcare, or more to the point, the absence of it, came up as a huge issue with all of the women I met. This is as an important an issue in the global South as it is here in the US. The solutions might be different, but the problem is very much the same. So with that little preamble out of the way, let's start with some facts. The global childcare crisis and its disproportionate impact on women predates COVID-19, as we all know. In 2018, a staggering 606 million women of working age were unavailable for employment due to childcare responsibilities, compared to just 41 million men. The pandemic brought a long under-acknowledged issue into the open and started an important conversation on the unequal care burden placed on women. Women in most countries are currently spending more than 30 hours a week exclusively on childcare. That is nearly the equivalent of a full-time job. As the pandemic begins to recede, it's important that we don't let this topic disappear from the global agenda, because we've learned that this childcare crisis is a global concern. More than 40% of all children below primary school age, that's nearly 350 million children, need childcare but don't have access to it. And we know that the childcare challenge disproportionately impacts families in lower and middle income countries, where nearly 8 out of 10 children need care but don't have access. For example, a child in a low-income country today is nearly 5 times less likely to have access to care than a child living in a high-income country. And this has costs for women and women's income potential. For example, women operating microenterprises, as many women do in emerging markets. Childcare duties are correlated with a baby profit gap, as businesses where children are present earn 48% lower profits than other female-owned businesses where no child is present. So there's a high cost to having to look after children and to try to earn an income at the same time. The childcare crisis highlights a problem, but it also represents an opportunity. According to the ILO, investing in comprehensive care policies would increase employment rates for women by 10% and reduce the gender gap in employment by 7.5%. There's clear evidence-based links between prioritizing childcare and realizing an economic return on investment via human capital development and increased female labor force participation. For example, ILO models estimate that 300 million jobs could be generated by 2035 if countries made wide-ranging investments in the care economy. And given female predominance in this sector, it's likely that many of these jobs would accrue to women. Expanding childcare in particular offers substantial employment opportunities. It's estimated that the expansion of the childcare workforce alone could create 43 million jobs globally. Providing access to childcare for all mothers could deliver between 2 and 4.5 trillion of additional GDP each year. As a proportion of GDP, lower and lower middle income countries would stand to gain the most with increased access to childcare. Expanding quality childcare can yield multi-generational impacts by promoting equity and improving women's employment and productivity, child development and nutritional outcomes, family welfare, business productivity, and overall economic development. However, we still lack evidence on scalable care models for developing countries which are gender intentional, as well as data underpinning the full extent of the problem. Which, with a range of partners, many of whom we're hoping on our call today, we're working on building a more robust evidence base on impact, viable business models, whether public or private, and return on investment for childcare initiatives. I recently had the opportunity to see some of this work in action at a Sewa urban childcare cooperative in India. The cooperative provides childcare services for Sewa members, all women working in informal employment, and it's building an approach suited to meet the care demands of this segment of women. But immediately following that, I met a group of women in a self-help group in the same community who had to manage childcare among themselves. There was an older woman in the community who was trusted and who did a lot of child minding, and the women in the group were happy to pay her to do this. But she wasn't able to look after larger groups of children because she lacked the space to do it in. We were sitting right next to a very large madrasa that had a ton of space that mostly wasn't used, but women aren't allowed to enter that building, and no other space was made available by the community. So they didn't have a solution. We at the Gates Foundation are excited by the progress that our partners like SEWA are making in identifying modalities of care that meet women's needs and build on the economic potential of investing in care. But we clearly still have a long way to go to make this available to more women. And the solution could be as simple as a dedicated space with women working out for themselves how to manage care in their communities. Since the 2019 Birdsall House Conference focused on designing childcare policies that support families, we've seen momentum towards putting care on the global agenda and movement towards identifying solutions. Yet we still have work to do to make sure policy solutions are taken up more widely. Much like 2019, we find ourselves at yet another key moment towards making progress in addressing the global childcare crisis. The policy issue of care has become politically salient in an unprecedented way in global and country-level contexts, creating a new but time-bound opportunity window to push forward this agenda. It'll likely take more than 10 years to see progress at scale, but this window allows us a chance to accelerate a global learning agenda on care by testing, implementing, and understanding what works. While the data on the criticality of care to economic recovery is clear, this case must be clearly and effectively made to policymakers in developing countries who will ultimately have to lead in advancing this agenda. One critical obstacle to scaling a care agenda in the past has been the assumption that among many other critical and competing priorities, care would not rise to the level of prioritization for lower and middle income country governments. We at the Gates Foundation are fully committed to supporting our partners in country to successfully make a case for value and return on investment in women's economic empowerment. Finally, we must contend with long-standing and outdated notions of who cares about care. Too many well-meaning but ultimately uninformed stakeholders are stuck in a mindset that care is an issue that only impacts the global north. While the data says otherwise, there is the widespread belief that lower and middle income countries aren't ready, can't handle, or don't care about these issues. However, we know both from firsthand accounts of women we've surveyed and in looking into macro and microeconomic trends that this simply isn't true. Nowhere in the world does a mother not want the best for her child, which means providing children with safe, affordable, quality care, and in turn offers women the opportunity to earn income outside of the home that can be invested in children. While we know that care is a critical investment to unlock poverty, pathways out of poverty, build human capital, boost women's economic participation, improve early childhood development outcomes, and increase equity, we have a long way to go in making this message universally accepted. Across countries, professions, and income brackets, the unsustainable burden of caring for children home from school and loved ones sick with COVID-19 has pointed to a critical hole in social infrastructure with compounding effects on the global economy. The imperative is thus clear. Now is the time for governments, policymakers, and donors to strengthen labor market policies and programs to ensure they benefit women, specifically by prioritizing investments that reduce and redistribute women's unpaid care work. We need to work together to build a case that access to decent childcare is as important for a poor woman running a market stall in Kenya or making rotis in India as it is for you and me, and that there are solutions out there if we think creatively and work together across public and private sectors. We're very excited to meet this moment and look forward to working with all of you to keep this crucial priority on the global agenda and advance the dual cause of early childhood development and women's economic empowerment. Thanks very much. I'll hand it back to Megan.
Thank you so much, both Greta and Amanda. Amanda for highlighting CGD's research agenda on this topic and our role in convening various partners like through events today. And Greta for highlighting some of the data that shows how critical this is as a development issue. As Greta said, I hope that all of you who are tuning in right now are already convinced, whether through the research or your personal experiences or both. But we too recognize that there are still a lot of skeptics who need to join us in recognizing how important investments in childcare can be for children, for their caregivers, for communities, and for whole economies. And on that last front, I'm now going to transition to introduce my colleague, Shelby Bourgault, Research Associate in our Gender Program, to give you a bit of a sneak peek into some analysis we have underway that will be published next year. Shelby, over to you.
Great. Thank you, Megan. If I could get my slides up, please. Awesome. Thank you. All right. So today I'll be presenting, as Megan just mentioned, some initial findings from a literature review on the evidence of childcare's return on investment. In June of this year, CGD and the World Bank's Early Learning Partnership team hosted a pair of technical workshops on childcare, which brought together researchers and experts to discuss the investment opportunity and existing evidence on what works for whom and the policy and financing landscape. Through these workshops, it became clear that research existed on the return on investment, but that no one had systematically mapped that evidence. Next slide, please. So we're conducting this review as a way to gather the evidence and build a stronger case for increasing investment in childcare infrastructure and to demonstrate the fiscal value of these investments across contexts and where government budgets are already limited. Next slide. We conducted our search on JSTOR, ScienceDirect, Scopus, and Google Scholar for papers published since 2010. We included two groups of keywords, the first around childcare and the second around return on investment, which we define very broadly to include not only the return to government in the form of increased tax revenue, but also including returns as increased income to individuals, increases to GDP, and analysis on the cost-benefit calculation. Through this search, we noted that there were many papers that examined the impact of childcare on women's labor force participation and on the number of jobs created, but that few papers go that extra step to determine what the return on investment might be. Next slide, please. We identified 28 papers that did go that extra step and included calculations or estimates of ROI. Over half of these papers were simulations. Another quarter employed quasi-experimental designs, and finally 1/5 were RCTs. Most of the papers, and particularly the simulation papers, analyzed ROI related to actual or imagined increases in public provision of childcare, and the remaining papers, about 41%, looked at the returns on vouchers or subsidies to private provision. Next slide. So the spread of our sample is fairly geographically diverse, but there is a higher concentration in wealthy countries, and particularly in Australia. 39% of the included papers are in high-income countries, 1/3 in upper middle-income countries, 1/4 in lower middle income, and only a single paper in a low-income country, which was Uganda. Next slide. The papers show mixed results for the return on investment for individuals. All of the papers that calculated changes in maternal employment agreed that it would increase. And this ranges from the low end of 6% in Chile to the highest estimate of 27% in Brazil. A study in Vietnam found that mothers were 41% more likely to hold a wage-earning job as opposed to self-employment as a result of getting childcare. And a study by Frame in Nigeria found that for every $1 invested in accessible childcare services, current unemployed primary caregivers would expect to generate $3 in increased economic activity. The evidence is less clear, though, regarding changes in income. Studies in Australia, Uganda, and Brazil showed a significant increase in maternal income, but studies in Chile and Ecuador showed no increase. Next slide. Evidence on the return on investment for the state included calculations related to tax revenue, as well as calculations of direct cost and benefits. In Quebec, the UK, Australia, Colombia, we found that the economic benefits of childcare exceeded the costs and that such investments can be self-funding and sustainable through the models that were examined in these papers. In Uruguay, South Africa, and Turkey, the cost of investments may only partially be recouped from increased tax revenue. So sustainability of these investments could be an issue. Next slide. All the studies that included estimates of GDP increases as a result of investing in childcare agreed that GDP would rise dramatically. And these estimates range from the low end of 2.6 billion in Scotland to between 11 and 27 billion in Australia. Next slide. Of course, relying solely on these numbers can be problematic. Presumably, most of the estimated increases to GDP would be generated from women who were previously doing unpaid care work, which is not counted in GDP, now shifting into paid work, which is. So in many ways, we know that GDP is an artificial estimate of economic activity, but we do believe that these estimates can be usefully employed to convince policymakers to invest more in childcare. Another constraint in these papers is that they use different methodologies and they look at different types of childcare provision and use different estimates of ROI. So this makes it very difficult to compare across contexts. Last slide. Finally, these initial findings can guide a research agenda moving forward. Number one, there are many gaps to fill in the ROI mapping, including across more geographies, in low-income contexts, and with different demographic contexts, such as places with very young or very old populations. It would be great to further assess and improve comparability across these studies as well, to be able to group findings more easily and determine what types of models could work across contexts. And finally, number three, we plan to collect what evidence exists on the ROI of alternative investments as well, in order to make a comparison case. Ideally, we would be able to make the case to policymakers that not only does childcare provide great economic returns in its own right, but that it provides better economic returns than other investments. And that's all from me. Thank you so much.
Thank you, Shelby. So we know that there are still gaps to fill, as Shelby flags, in the evidence base, and that this needs to become more representative of low and middle income country contexts. But we hope that the synthesis analysis Shelby just presented and that we'll have published next year will be a start in moving in the right direction to be able to make the case to ministers of finance and other relevant decision makers that childcare is, in fact, a cost-effective and sometimes a best buy type of investment. So once we convince the people who need to be convinced, we also need to be able to tell them what works and how to design and implement childcare provision models to reap the benefits for children, for mothers, for other caregivers and communities. And that brings us into a presentation by our colleague Kende Ajayi, Senior Fellow also with our gender program, to discuss research just launched this week from an RCT in Burkina Faso. Kende, over to you.
Thank you, Megan, and thank you everyone for joining us today. As Megan mentioned, I will be sharing some research results from a recent study that we've just released looking at the impacts of childcare provision on women and children. Next slide, please. So the motivation for this study was the observation, as Greta clearly shared, of the fact that women are most likely to be children's primary caregivers in contexts across the world, and existing evidence, increasing evidence, that these childcare responsibilities limit women's economic opportunities. At the same time, there is a wealth of evidence demonstrating the positive potential of investing in early childhood development as a powerful strategy to reduce poverty and improve long-term socioeconomic outcomes. But a key question that hasn't been tackled in both research and program design is whether we can bring these two aspects together, and to what extent subsidizing childcare provision can address both these issues, increasing women's economic empowerment on one hand and stimulating early childhood development at the same time. Next slide, please. So our goal in this study was to analyze the effects of a low-cost model of integrating childcare centers into a public works program in Burkina Faso to look at this question. So we used a randomized control trial to evaluate what the impacts of access to these childcare centers is on women's economic activity, broader measures of women's agency and well-being empowerment, and also looking at impacts on children's development. Next slide, please. So to give you a sense of the context, this was a program that was implemented by the government of Burkina Faso with a goal of improving youth employment through a public works program. Young people between the ages of 18 to 45 who were not enrolled in school were invited to apply to this program and randomly selected to participate for 6 months of guaranteed employment, earning about $62 a month. And 85% of people who applied to this program were women. But in early stages of implementation, it was observed that a lot of women came to this public works with children and were balancing childcare responsibilities with their public work assignments. And so in the context of this public works program, the team developed a mobile childcare center, and we looked at 36 sites with the potential to host a childcare center, and randomly assigned half of them to receive one of these mobile childcare centers and half to have no additional childcare provided. There was some existing availability of childcare centers. So in our baseline sample, about 12% of households used a childcare center, but this tended to be for older children in the age group, so from 3 to 6, not the really young ones from 0 to 3. And clearly there was not high levels of usage. Next slide, please. So what did these childcare centers look like? The objective was for providing a safe space for children to play during the day between 8 and 2. They were provided with nutritious meals, a stimulating curriculum, and critically, volunteers from the Public Works program, so Public Works participants, were trained for 3 days in basic techniques in child stimulation, basic health standards and nutrition, and basically given the skills to be able to operate these childcare centers as their Public Works assignment. In addition, low-cost toys and learning materials were provided, and there was some additional parental education provided for parents on how to engage with their children at home outside of these childcare centers. Each site has a capacity for 50 children, and there was a nominal contribution of $6 a month for snacks, which wasn't strictly enforced, but was encouraged to support the childcare centers. And this was an intervention that was developed in close consultation with specialists from the Ministry of Education, Social Protection, as well as early childhood development specialists in the country. So to give you a sense of the timeline, the Public Works started in July 2019 and went for 6 months up until February with a break in between. The childcare centers opened midway into that, so in November 2019, and we did a baseline survey interviewing a sample of 2,150 female Public Works participants who were primarily responsible for a child under the age of 7. So these are children who would be eligible for using the childcare centers. We had planned for the childcare centers to run uninterrupted for a year, but COVID happened a few months into that. So after 4 months, the creches closed because of COVID. They reopened in October, and we went back by phone survey because of COVID restrictions still at the time, but we went back in February 2021, which was 14 months after the baseline survey, and tracked 1,990 of those women from that baseline sample to ask them about their current economic outcomes, their broader measures of empowerment, and also to ask them about their children's development and well-being. Next slide, please. So what did we find after this 8 months of potential usage of the childcare centers? We find that there was a huge increase in usage of childcare centers. So if we look at in the gold bars there, those are usage rates from the likelihood of using a childcare center in the past year for women in sites, the 18 sites where these childcare centers were opened, compared to in the blue, what we see in the control sites. So almost a quarter of women in these areas where the Public Works, the childcare centers were provided, used one. And this tripled the overall usage of childcare centers in the past year, from 12% in the control group to over 37% in the treatment group, which demonstrates that, next slide, please. Which demonstrates that there was a substantial increase in the use of childcare centers and a big demand for these childcare centers in this context. So we went from 12% usage in the control group to 36% usage in the treated group. Next slide, please. So what did this mean for overall well-being? We find, and here I'm just presenting the summary, looking at impacts on 5 dimensions: women's employment, women's participation in decision-making and their attitudes towards gender equality, mental health, financial inclusion, and child development. We find significant positive impacts on women in employment, so 0.1, almost a 0.1 standard deviation increase in overall employment outcomes, both for women in the full sample and as well as women who had younger children. This is women aged 0 to 2. We find no significant impacts on decision-making and involvement and views, attitudes towards gender norms, but significant impacts on women's mental health, financial inclusion, and the strongest impacts on child development. So what this overall demonstrates is that this intervention, so providing access to affordable quality childcare, increases both women's employment and child development, although we don't see significant impacts on women's decision-making. Next slide, please. So I'll talk about a couple of things to keep in mind with this context. One is that the COVID pandemic was something that was happening in the background, which reduced childcare exposure from 8 months to 8 months instead of 1 year, and also had some potentially dampening impacts on women's economic outcomes. And so what we see here is suggestive of potentially larger impacts of sustained childcare provision in a less disrupted environment. At the same time, we did some cost effectiveness analysis, which demonstrates that this intervention basically paid for itself. The monthly cost of a childcare center was about $24 per child per month, and that's similar to what we find in terms of increase in monthly earnings for women who use the child care centers. This is somewhat less cost effective than some other childcare models, but mainly due to the fact that these childcare centers cater to children from the ages all the way from 0 to 6, and there is a higher childcare provider ratio for catering to these younger children. As I showed earlier, we find significant impacts for that age group as well. Next slide, please. So in conclusion, this study demonstrates that access to childcare in this context improved women's employment and financial outcomes, both directly by employing women as childcare providers and indirectly by relaxing constraints on their time. We also find significant improvements in child development, although there are no significant impacts on decision-making agency or gender attitudes, which overall highlights the importance of looking at multiple dimensions of women's well-being beyond just employment, and potentially thinking about other complementary interventions to address gender dynamics, intra-household dynamics, and in this gender transformation beyond childcare provision. Thank you.
Thank you, Kinde. This is a particularly neat full circle moment for me, and I think for many of us, because the Birdsall House Conference that Amanda Glassman referenced that we held in 2019, Kinde at the time was working at the World Bank at the Africa Gender Innovation Lab and came to present this new RCT that she was planning on designing and launching. And now, years later, to have these results, to know that this is the type of model that works for children, for women, it's cost effective, is particularly powerful. Now I'm very pleased to welcome Luis Miguel Galindo, who is a professor of economics at the National Autonomous University of Mexico. To round out our research findings presentations, he's going to be discussing the financing and costing of childcare systems. Luis, welcome, and thank you for being here.
Thank you very much. Well, just going very fast in considering time constraints. Basically, what we were trying to do was in Latin America, there is, of course, all these problems, women labor participation and children care, there is not very much development. However, we were trying to develop from the fiscal point of view a model to try to see how it will improve the children care system in Mexico and how it can be financed, this system. The first slide, please. Basically, what we were trying to see is if this is the case, and I mean, they have shown already the people that talked before me, but basically I'm just going to concern in 2 or 3 things. Now, in general, in Latin America, poverty is having the face of women and children. So we need to address that urgently and solve that problem. So we try to see, we basically in Latin America build a system that it has health, education, and pension part, but the care system part of the 4 pillars of this universal care system doesn't work. So we are trying to build in that system now. No? And we try to see in this case that basically to invest in children care is an intelligent fiscal measure. That is, it has, of course, a consequence directly on children because of what we all know. It has long-term consequence because of productivity. And of course, in second case, it has significant consequence in women labor participation and in gap salaries in the formal market. No, that is, when you take a bit of the time constraint that face women in Latin America or in Mexico because of children take care, informal children take care, so they can participate in much better conditions in the formal market, and then that, of course, improve their conditions. And in the third case, it has also a consequence on employment, output, and income revenue for the government. Next one, please. That's a very important part because when we see how is the cycle of incomes and expenditures in families and in people, we see that basically you try to finance, children spend more what they get and old people have the same problem. And in the middle, you have saving times that you use to pay for children and old people. However, when we see in how is this situation in general of the world, we discover that in Latin America, that's done more by the families and less from the public sector part. That is, we are financing the families directly, all these children care and the adult care. And therefore, that's a significant bad long-term consequence and intergenerational distribution and consequence. So we try to build a model that it has different types of options. The next one, please. Different type of options to see how you can build this care system. The model, basically what we do is from the micro point of view, we estimate all the costs that it will have on this system, which basically is food, wages, construction, and all these other expenses that you can have. And we have these estimations from the microeconomic point of view, which includes, for example, psychologists, nurses, all this part of the system. And then we see how the population will evolve in the next years. And we try to see how is the actual supply now. So with that, we estimate the gap between the actual demand and the supply and how it will cost to address these things. When we do that, and after having all these numbers, we make different assumptions in the model about the quality of the system and the coverage. That's, for example, it's possible to reduce the number of children that is taken care of by one person, or, for example, the salaries of the nurses or the psychologists and all these people. And then after that, we include that in an input-output model, and we see what will happen in the employment and GDP growth in Mexico. And as they mentioned it before, we have a potential significant impact in these cases. Next one, please. So what we see in this case is that, at least in Mexico, to have an investment in children care system has a triple bonus. No? It has a positive effect on children and children's long-term productivity. It has an effect on women on participation in the formal labor markets, helping to reduce the rate of participation of women against men, and as well, it reduces the salary gaps in that sector. And in the third case, it has a significant impact on output and employment. Therefore, it's a measure that you can do it. When we were making all the calculations, we have different scenarios, and because, for example, if you put it immediately, it has one cost, but if you put it in 5 years' time, it has a gradual increasing cost until the 5th year is a universal system. So we do that, and we do as well how to deal with the children from 0 to 2 years. And basically what we discovered is, for example, I'm just going to put general numbers. We have already spending in children care about 0.5 of the GDP. This will cost in general a bit more than 1% of the GDP. However, you will receive from additional fiscal revenue another significant part. So therefore, the total new expenditure in this system is less than 1% of the GDP. So that's possible to afford, considering the situation and the relevance of children's situation and the low labor participation of women in Mexico. So in that case, the estimations show that it's an intelligent fiscal measure. And second, that we have a tool to simulate different scenarios of how to address this and how it will cost to invest and put 10, 20% of the children population, 50, whatever, and what will be the consequence on that, on the employment and the GDP consequence. We are trying to work now more in the matching model, try to see if you can specify for certain regions in Mexico the construction of these children care centers, what will be the consequence in labor participation and in particular in women participation. Thank you very much.
Thank you so much, Luis. We really look forward to staying in touch as you continue your work on the labor force participation outputs and anything else you plan to do with this research agenda.
Yeah, it will be a pleasure. Thank you.
And we've been talking time and time again with research partners, with civil society advocates, with investors and donors in this space. And we've been hearing, we need to find a way to bridge this gap between the conversations that we're convening, sort of globally oriented, and interfacing with institutions like the World Bank and the IMF. And how do we bridge that gap between that global level and now the national and even subnational level? And I think Luis, his presentation offers a great example of how to drive this change through rigorous research, grounded in a particular country context, applying those methods in a context-specific way to the policies and realities, because those are the folks ultimately that will need to be convinced. So with that as a nice segue now to our forward-looking discussion and our panel of speakers, very pleased to introduce Nabila Agwele, who is the Senior Advisor to the Minister of Finance for the Government of Nigeria. We also have Jane Sloan, who is the Senior Director for Women's Empowerment and Gender Equality at the Asia Foundation. Bama Athreya, who is Deputy Assistant Administrator at the U.S. Agency for International Development. And last but not least, my colleague David Evans, who's a senior fellow working on these topics at the Center for Global Development. Hello to you all, and thank you so much for joining today's conversation. Nabila, I would love to start with you. We've just heard from Shelby, from Kende, from Luis on how childcare models can be designed to benefit children and caregivers, how these investments could be designed effectively and how much they would cost, and the gains that they would have for things like tax revenue, labor force participation, and GDP. So with all of that in mind, coming from the Nigerian context, how would you say this sort of evidence could be harnessed? And how would you say the Ministry of Finance, where you're sitting, can work with other ministries, with international institutions, and with partners like ourselves to elevate this agenda within your government?
Great. So first off, thank you so much, Megan, to you and your colleagues at the CGD for really championing this important work and for convening us today to have this really important discussion. I'm really blown away by the research that we've just seen presented, and it goes to this notion of having credible, country-specific, and of course also global data that helps drive advocacy at the policy decision-making level and can really complement existing country interventions around women's equality and of course women's economic development and labor force participation. So in the Nigeria context, I think as in other contexts, both regionally and in the global south more broadly, this is extremely important. I'd like to point, of course, to all of the data, but I'm particularly excited by the presentation from Kehinde, which is an Africa-specific presentation, and also with the frame report on investments in childcare that was referenced during one of the earlier discussions. So the FRAME report came out in June of this year and provided credible evidence as to returns on it, not only returns on investments in the Nigeria context, but also attitudes of citizens towards whether this is important. And you heard earlier an observation as to this perception that discussions around unpaid care or investments in childcare are a Western issue, a Western construct. And I remember when we were first exposed to this topic last year, as were many, as part of discussions post-COVID as to how to improve gender equality and women's participation and empowerment. A lot of the discussion on ground was, what is the relevance here? Where is the data? And what's amazing is you see in just like a year to 2 years already emerging credible data from the Africa context and from the Nigeria context. And I would like to say, just in the FRAME data, they made a conservative summary that investments in childcare would lead to a conservative 8% increase in labor force participation, which is about 9 million people entering the labor market. So that data is irrefutable. For us at the Ministry of Finance, the Honourable Minister has, over the course of her tenure, and especially post-COVID, championed issues around gender equality, and specifically is leading work at the intersection of fiscal policy, public financial management, and gender equality, recognizing that it's the right thing to do, period, but also there's building evidence and support around linkages between women's empowerment and participation and national development more overall. And as part of that, we've seen now a gender responsive budget in Nigeria for the first time. Our budget for this year and also for next year has specific requirements around gender responsiveness. We also earlier this year, just like a few months ago, launched a monitoring and evaluation framework to measure performance of women's economic empowerment interventions at the government level. So this is work that the minister is leading at the Ministry of Finance, and also working closely with development partners such as UN Women, of course, CGD, Gates Foundation, the IMF, and the World Bank to really push this on multiple fronts. Where we are in terms of looking forward, and for me, looking from the technical advisory perspective, the data is so critical. Having data that is true to the local context, that speaks to where we are on ground, and that also can be used to then invite early adopters, those who are already advocates on ground, such as the Ministers of Finance, and of course the Minister for Women Affairs, and other advocates, whether it's state governors, whether it is traditional rulers who are pushing on gender equality. So the idea is now to take this data and to say, look, we have increasing evidence in the country context and in the Africa context, and how can we take this forward? Some ideas that come to mind other than advocacy, so really taking the data and doing advocacy in a way that actually will reach the intended beneficiary. So in some contexts, we may use language around unpaid care. Those of us who are participating in this program are definitely advocates and champions and early adopters and have bought into it. But for those policymakers on ground, some of whom are actually still grappling with notions around gender equality and women's economic empowerment, we need to really think critically about how to present this information. And a lot has been said about linking credible data with tangible community-based stories in the context in which we want to serve. So I think that's really, really important. Other than that is to say, what are some of the existing programs in country, for example, that focus on whether it's women's economic empowerment or labor force participation, and where are there opportunities to quickly pilot interventions in states, in communities where there are already champions and there are already existing programs, and there's an appetite to use those piloting mechanisms to build increasing data and build increasing awareness and buy-in around these issues. So for me, this is super, super exciting. And what I would do as an immediate next step would be to take this information, have a conversation with the minister, with others, and then also think critically with stakeholders in country and globally as to how we take the conversation forward. Thank you.
Thank you, Nabila. Super helpful to have that context. And those of you tuning in will see the report that Nabila was citing. done by one of our partner organizations, Frame, on the return on investment opportunities specific to Nigeria. Pretty compelling stuff. And I really appreciate you just having set the tone by thinking towards what you specifically can do in collaboration with your boss, with the minister, to drive this forward in your country. So I think if everyone tuning in today is sort of programmed in that same lane, and we are driving this forward by taking individual responsibility for a piece of this very broad agenda, that's just phenomenal. So thank you, Nabila. Jane, we're going to switch continents now, because the Asia Foundation, in collaboration with CGD and other co-hosts, just hosted a very exciting event, a conference on care alongside this year's G20 summit. So if you could talk to us a little bit about the objectives and the outcomes of that event that just happened a few weeks ago, and what you think is needed to now maintain the momentum going forward, given that we'll have the G20 presidency held by India, the G7 presidency held by Japan, and APEC, all happening in the Asia region this coming year. Over to you.
Thank you, Megan, and thanks so much to you and to CGD colleagues for this really important forum. It's a pleasure to be here speaking on Gadigal country in Australia, 2:00 in the morning, and to be able to share more about our recent event, the Bali Care Economy Dialogue, which took place last month in Bali, Indonesia. And of course, Megan was there, Bama was also there, and gave a compelling presentation. The dialogue was explicitly designed to do three things. Firstly, we wanted to create a forum to elevate issues related to decent care work, dignity of care, and building a decent care ecosystem. And of course, these issues are of increasing interest in Asia and the Pacific. However, the solutions and the synergies are still relatively nascent across these areas. Secondly, we saw a need to build the knowledge base around care by synthesising key insights and gaps and actionable solutions related to the care economy, which was the focus of a draft white paper that we developed to ground the discussions at the dialogue and help us to quickly focus on the issues, the opportunities, and the promising approaches. And third, we wanted to provide a platform where diverse actors could engage in joint learning, knowledge sharing, and the co-development of an actionable roadmap for collaborating on transforming care. Importantly, we saw the dialogue and the white paper as opportunities to highlight Asia and Pacific perspectives and priorities on the care economy. And this included childcare as well as the full spectrum of care. So looking ahead, we hope to work with our partners to highlight these priorities more prominently under India's G20 leadership in 2023. In terms of what's needed to maintain momentum, on the third and the final day of the Bali Care Dialogue, participants brainstormed actionable strategies for elevating care across national and regional agendas, such as APEC and ASEAN, and at next year's G7 and G20. There was agreement among Bali Care Dialogue participants that we need to take advantage of the current energy around childcare and encourage more donor countries to contribute to the World Bank's new Invest in Childcare initiative. And just as importantly, low and middle income governments need to make use of these funds to prioritise investments in childcare in their countries. And more international finance institutions and bilateral donor agencies also need to prioritise investments in childcare as the World Bank has done. There's an opportunity for all of us to work together to call upon G7 and G20 countries in 2023 to increase their funding allocations to childcare and to invest in new and best practice models. We also identified the need for three things. Organisations and governments need to invest in care data collection and analysis. Our white paper, which we plan to launch in January 2023, will provide an overview of the care landscape in Asia and the Pacific. And we hope that the paper will propel a conversation on care and encourage more research on the topic and intersections with care. Secondly, country-level convenings are needed to catalyse the kind of collaboration and synergies that we saw taking shape at the Bali Care Economy Dialogue. The regional convenings are critical for the agenda setting and the building and sustaining momentum, while we need to really ensure that effective coalitions at the national level occur so that we can really cascade that into action. And thirdly, investment from public and private sector donors is vital to adapt and scale promising approaches in different settings. So, for example, we're eager to establish a care fund to channel funds to civil society groups so that they can innovate and collaborate on testing and scaling a variety of models for childcare and other forms of care.
Thank you, Jane. That's excellent. Obviously, it's a big year, 2023, for the Asia region, with all of these global convenings taking place in your part of the world and where your organization focuses. I think what's coming across loud and clear is obviously more financing is needed, whether that financing is being directed to local civil society actors who can then be taking more charge of this agenda, whether it's needed to be funneled into increased and improved data collection and analysis, or whether, as you mentioned, we have these specific mechanisms to take advantage of, like the World Bank Invest in Childcare initiative. How great would it be, now I'm going to turn to you, Bama, if more G7 donors were contributing to that fund, and if more countries are incentivized to make use of those funds? Bama, as Jane flagged, you were with us in Bali, so would love to hear not only your reflections about that convening and where we go from here, but also what the US specifically is doing multilaterally and bilaterally to be championing this agenda. What else do you think your counterparts in other governments can be doing to work with you?
Thank you so much, Megan. And I do want to start by thanking CGD for this conference is always so valuable. This year, particularly valuable, and appreciate the chance to be with so many great thinkers on this topic today. So I will start by saying, we've just referenced a couple of times the World Bank Invest in Childcare initiative. I don't think we've actually, and I think there maybe is an assumption that everyone in the audience, of course, knows what it is, but I do want to take a minute to sort of talk about that as a signature initiative that we, the U.S. government, USAID in particular, held up and elevated earlier this year as a really unique opportunity. So it is a new initiative. It is a multi-donor initiative. The U.S. government, as President Biden announced in the G7 Leaders Summit in June of this year, have committed to up to $50 million over 5 years to this initiative. And we have been very pleased to see that that commitment really sort of responded to and matched by a number of other bilateral and private donors as well. Our goal is to generate collectively at least $180 million to address the gap in childcare infrastructure with the outcomes that also affect women's economic empowerment, early childhood development, and broader economic growth and human capital development that have been talked about already in this conference today. And so we are seeing that this is a moment when there's a tremendous opportunity because this initiative has succeeded in spotlighting in a unique way a collective agenda and allowed us to change the narrative around childcare as a critical development investment. And even though there may have been initiatives and resources happening at national or regional levels before this, really sort of bringing it all together, at this level with a major global stakeholder, obviously the World Bank, leading is really enabling us both to increase the investment in childcare, and that has already been the case. As World Bank has confirmed, that World Bank itself is now channeling more resources to this subject than ever before. And also, again, the amplification aspect, right? Amplifying each other's voices, having something that helps all of us, whether making the case at local levels, subnational levels or national levels, be able to point to a global initiative and a global, really, sort of multiplier effect for all of our specific initiatives. So the second thing I want to mention as an opportunity. So, first of all, let me just say that is an opportunity. It's a very specific, concrete opportunity for anyone who's, tuning in today to consider lending their support to. And then I'll also talk about another USAID initiative. And that is our Catalyze EduFinance, which is an early childhood care and education activity that we've launched with over $10 million identified to date. So the idea here is to work at national levels, right? To implement activities in at least 5 countries. We've actually got some focus countries already. If I don't run out of time, I'll talk a little more about that. Focusing again on these paired development outcomes: women's economic empowerment, early childhood development, and job creation. And the incubation activities that are going to be supported through Catalyze EduFinance are intended to identify, test, and refine private sector approaches to early childhood care and education provision. So this will help us to mobilize private finance as another important contributor to the work that's needed in this sector, to improve service delivery in the areas, the target countries where we'll work. And we will be coordinating, obviously, sort of across what the World Bank is doing through the Invest in Childcare initiative, what we're doing through these activities. And, this is an opportunity, again, to, sort of look at other models, innovative blended finance models that could potentially go to scale, learn from them, harness them, and then, sort of potentially channel everything back together. One more thing I'd like to say, since you've asked, is about how we intend to use our voice in multilateral venues. And we see the Partnership for Global Infrastructure Investment, or PGII, as a space where we've already elevated care as infrastructure. We've spotlighted the World Bank initiative, and we've really encouraged other governments to consider similarly elevating care as infrastructure. And I think that's, sort of been reflected in some of the responses from other governments. And so we do intend to continue to elevate care as a priority in G7, G20, and other multilateral spaces. A couple of things that are also important, and one that in particular that I want to note is we just very recently, just a few weeks ago, submitted our letter of intent to join the UN Women-led Global Alliance for Care. And so this is just yet another signal of how the US government really is intending to not just, as our Administrator Power has stated, we want progress beyond programs. The investments in, Catalyze EduFinance, in the World Bank Investing in Childcare initiative are important in and of themselves. But what we'd like to do is really take those and other investments we're making and bring them to these multilateral spaces, such as the Global Alliance for Care, share what we're learning, understand what other governments and other stakeholders are learning in those spaces. And really, we've got to do this all together and build out a global ecosystem for care. And that's part of what we intend to do. So, time permitting, I can talk a little more about some of the specific activities. Let me just start by saying, and then I'll turn over because I think I've probably run out of time by now, that in terms of the country focus, for those who may have an interest, we're committing to, under Catalyze EduFinance now, I'm speaking about just supporting work in Honduras, Paraguay, South Africa, Rwanda, and India. Some work is already underway in South Africa and Rwanda. And we've started co-creating some activities in the other countries that we've identified. So, as we have time, we can talk a little more about that. Thank you so much.
Thank you, Bama. That's excellent and really specific and detailed. And I appreciate you flagging both the commitment to be engaging multilaterally through the Global Alliance, as you've mentioned, that exciting new commitment of the U.S. joining, and the World Bank initiative you've already signed on to contribute to, and then also pairing that with your bilateral engagement through Catalyze and other things. Dave, all of this, whether pilot programs on childcare in Nigeria or the World Bank initiative, all of it needs to be grounded in data and evidence. And in addition to what we heard earlier from Kehinde on what works and some of the research you and co-authors have led yourself, what else do you think is needed on the data and evidence front for this agenda? Over to you for that.
Thanks so much, Megan. There are so many gaps in data and evidence in this space that hold policymakers back from making the decisions, the best decisions on what programs to support based on the evidence. And it's important to remember that these gaps in evidence also mean that families, that households, that mothers don't have all the information they need to make the best care decisions. In terms of data, a lot of studies of childcare focus on the children, and that's really important. We still only have those data for a handful of countries and childcare models. And like Nabila highlighted earlier, data on the ground is absolutely crucial for this. And so, it's fine to be in a country and say, oh yeah, they tried this in Brazil and it was really effective. But, if I'm talking to, the Ministry of Finance, the Ministry of Education, or in Malawi, that's just not a model that's necessarily going to be that informative. And even while we have a number of studies on the impact of care on children, there are far fewer that looked at the impacts on others in the household. So co-authors and I demonstrated in a science article last year that less than 1 in 4 studies document any impacts on mothers. And so Shelby presented, those results earlier, but where we do have a few studies that show those, but it's just a tiny fraction of the studies, and even fewer document impacts on other members of the household. So, in Brazil, a study of childcare, we found modest impacts, positive impacts on mothers, but then enormous positive impacts on grandmothers. And what that means is that we are likely significantly understating the return on investment, those economic benefits of care interventions. And what that means is that we're underinvesting in them as a result. That isn't just a hypothetical. So to ameliorate this, what we really need is to think about how every evaluation of a child care intervention can include a few things. The characteristics of the intervention, right? What did it look like? The quality of the implementation. There's huge variation in quality, and we know from good evidence that it matters. Not only impacts on children, but also on mothers and other members of the household. And lastly, the cost of the intervention. I don't know any minister of finance in good conscience that's going to buy a program without looking at the price tag first. So there are instruments to measure all of these, so researchers don't have to reinvent the wheel. But because academic journals don't value all of these aspects equally, researchers won't by default prioritize all of these. And that's where funders can play a major role in saying, hey, if we're going to finance this evaluation, which we should do, we want to make sure that you do measure this broader array of things than maybe the academic journal that the researchers are focused on. I'll mention one other piece on the evidence side. So that's the data side. In terms of the evidence, we see, I would say we have this growing body of evidence on the impact of care on children. And my read of that, even though there is some variation, is that in low and lower middle income settings, those impacts are mostly positive. We saw that from Burkina Faso, from Gahinde this morning, my own work in Brazil, and other studies show this. But there are some models of care that we actually know very little about. And so one of the most common forms of childcare is home-based care businesses, right? Where a person, usually a woman, will care for several neighborhood children in her home for pay. These are a middle ground. They're smaller and more personal than big public center-based care, but they're also less regulated. And so there's more potential for risk. And so we need evidence both on the impacts of these care arrangements and on how to make them better and how to make sure that they're safe. We lack evidence on the economic returns to childcare businesses. And in some cases, these might offer dual benefits, both to mothers who need care and to small business owners. So this is a question of generating evidence on how best to help both mothers and business owners reap the economic and personal benefits. This is an area where there's a big gap, and the world will be much better if we fill it in.
Thank you, Dave. And I think you've really sort of walked the talk in your own research, and for other researchers tuning in, as well as funders on the line who can incentivize movement in this direction, as you said, the need to pay attention to the characteristics of design of these models, the quality of implementation, even if the words on paper look good, did it work in reality? The impacts, not just on children, but also on caregivers who will, by definition, be impacted by these types of interventions, and the costing data is such a clear roadmap, I think, for others to take on board if anybody else is going to do a childcare study going forward. So all of you have already sort of moved us in this direction. But before we close, I want to be able to do one more round and come to each of you to talk about coming out of today's conversation and sort of the emerging field that's growing around it. What is a commitment you feel you can make going forward? And what do you need from others to make your life a little bit easier and your impact a little bit bigger? Nabila, we'll start with you again.
Thank you, Megan. So in terms of commitments, I think, where David ended is a really good place to start, this notion of the data in terms of why this is important. So for me, at the country level, both with respect to policy decision makers and even our stakeholders in country, our partners, it's really to say, let's continue to ensure that there's this advocacy and there's this consensus around who are the potential champions, making sure that people on ground are exposed to the data, the emerging data, whether it's the work that Kehinde highlighted or the FRAME report on return on investments, which I've been sending to a whole bunch of people, and then saying, where can we begin this conversation? Now, before we get to the financing side, there needs to be buy-in from those who would be implementing, both at the state level and then those federal government stakeholders who would then have to design policy or make commitments around it, which would attract financing. So for me, the commitments around sort of continued advocacy, thinking through where are there existing programs or there's existing opportunities to quickly sort of add this on. And I love what was being said by Bama about, this paired development outcomes, also helping people understand that it's not an either or. We, like many other countries, are fiscally constrained. So from the financing perspective, there's going to be this consideration of people already will be like, Nabila, we have so much else to consider. This is yet another thing. So really thinking critically about ways in which to approach this in an integrated way and to ensure that it's looked at holistically as part of existing interventions. So it's not an either or, it's an enhancer, and tying that to labor outcomes and ultimately GDP and revenues from that.
Fantastic. Thank you. I think it's pretty powerful stuff when someone sitting within a Ministry of Finance of such a large country like your own is going to be working to convince those who would need to implement these interventions and then figure out, how to finance and support. And we would certainly, I think, like to continue the conversation to make sure you have sort of the ingredients you need to be able to say, hey, do this, not that, and this is going to be the return that it will yield. Jane, let's go to you next.
Thanks, Megan. It's so inspiring to hear what you just shared, Nabila. We're committed to finalising the white paper on building a resilient care ecosystem in Asia and the Pacific, ahead of a virtual reflection session that we'll be hosting on January the 12th with our partners, including CGD. And this will be an opportunity to bring US policymakers, donors, and corporate and civil society leaders into the conversation that we started in Bali. And then by sharing the recommendations and outcomes from the Bali Care Economy Dialogue, we hope to engage a broader community to join and build this movement with us. We also commit to working to mobilise the resources that are necessary to carry the momentum forward, focusing on strengthening the collaboration that was initiated through the dialogue to build a strong movement for change, working in concert with the Global Alliance for Care, sustaining our convening power, including socialising recommendations and approaches at a national level in different countries to build momentum and action, continuing to build the evidence base for transforming care, driving a strong advocacy and communications initiative to engage key players in transforming care across the region, including for a G20 side event next year, and catalysing demonstration projects in the lead up to the G20 in India. And for demonstration projects, one of our dialogue partners, the Self-Employed Women's Association, SEWA in India, has shared with us a concept note to cascade a series of childcare cooperatives across 3 states, as well as a franchise model to train rural and urban women to manage childcare centres for informal women workers, as well as other working mothers. And crucial in this modelling is the holistic and integrated approach that we've been talking about that includes healthcare, early childcare education, water and sanitation, nutrition, and safe spaces for women. So we recognise the need for a range of models, and we need that donor funding to invest in these demonstration projects so that they can be adapted and scaled across countries and communities. So funding this work with SAWA would be an important start and contribution, especially as SAWA has already proven through its current childcare centres that all children go to school, there's no severely malnourished children, there's improved health outcomes, women's incomes increase by up to 50%, there's increased overall household income and shared power, and children exhibit healthy social behaviour. So it's a generational commitment that we're talking about for intergenerational impact.
Thank you, Jane, and really appreciate you making that point at the end about spotlighting these types of projects, especially when they are backed by such well-respected organizations like SEWA, the Self-Employed Women's Association in India and across South Asia. You know, they've been doing this work and now they've evaluated it, and to be able to take that next step to finance and scale it would be really powerful. So thank you for identifying something really concrete that others may be interested in. Please do reach out if you are. Bama, you next.
Great. So thanks. And I will just make 2 commitments here and 1 ask for the audience. The first commitment is to use the evidence. I think this has been a really valuable space. We've heard, of so much new and emerging research. And one thing that USAID will specifically commit to do with Center for Global Development is to ensure we are disseminating what we know, the evidence that we have so far within USAID, including to all of our field missions, so they can use it to grow our portfolio of relevant activities addressing childcare and all aspects of care in the countries where we work. So that's commitment number 1. Commitment number 2 is to invest in caring for care workers. Over the past year with the World Bank investment, we really have put a marker out there about the importance of improving options for childcare, right? Quality childcare for families. But the other part of that is making sure we have a resilient care workforce. And indeed, we know that most of these jobs are female dominated, of course, low paid and often informal. We need to formalize and advance decent work in this sector, and that's something we're going to be looking for some new opportunities to do. And then what we need, coming back to where we started in the really wonderful opening remarks to today's conference, there's been, obviously a lot of activism in gender justice movements for a long time to recognize, redistribute care work, right? And particularly to deal with unpaid care work. And that's great, but that has been somewhat disconnected from the equally robust movement for child protection and for investing in children. And what we really need from anyone who's listening today and anyone you can reach is to see these movements, these social movements really converge. Civil society actors start to really sort of pull through pieces of advocacy that have been effective at national and global levels and start to put them together. And really, we'd like to see a global movement for care that we can then really, be drawing from. And that's pushing us to do even more than we're doing now. Thank you.
Thank you so much, Bama. We are really excited about continuing to synthesize and disseminate the evidence we already have. As you say, I think so critical to put this spotlight on the protection of care workers and making sure they can do their best work by being well-resourced and well-supported themselves. And pretty powerful to hear from you sitting within USAID for all of the advocacy organizations, civil society folks, researchers on the line who may be in the gender bubble or may be in the ECD bubble. Let's work together. Let's come together. That's what our target policy audience feels is necessary. Dave, over to you for your commitment and what you need from others before we close.
Thanks so much. I would say, so from the perspective of a researcher, one of the things that I've been working on with colleagues is making it easier for childcare researchers to investigate impacts on broader households and livelihoods. Most people who research childcare are child development experts, and that makes sense. But there are resources available. We've put together some work on how to more easily measure the impacts on maternal mental health coming out of childcare interventions. For what it's worth, the impacts tend to be very positive, but it's actually not hard. And so we're working on making it easier for researchers, developing standardized tools so that researchers can more easily measure impacts on maternal labor force participation and other aspects of household well-being. That's one piece. In terms of what we need, of course, we need more evidence on this. They'd take away my researcher license if I didn't say that. But I think we especially need particular kinds of evidence. I remember a conversation with a policymaker in Brazil a few years ago where I asked her, what evidence do you most need in this space? And what she said is, I need comparisons of different models. Right? And so it's great to have the kind of evidence that Kehinde showed us this morning, the kind of evidence that I've generated elsewhere, where we say, hey, what's the impact of this model? That's a big step forward. The next step is to be able to work with governments and say, hey, let's try two competing models of providing care to see which ones deliver the best benefits, both to children and to their families. What kinds of hours, what kinds of training, what are these different aspects that will deliver the best benefits to society? That's the next generation of evidence. It'll take funding to do it, but it'll have a big payoff.
Thank you so much, Dave. I just want to thank each of you one last time for contributing to a really rich conversation that I have no doubt will be continued in more sort of detailed and context-specific ways. Thank you to all of the folks behind the scenes who have made this event possible, and especially to you, our audience, for tuning in. Again, please do reach out if there are creative sparks in your minds that you want to follow up with CGD or any of our partner organizations on. With that, I'm going to turn it over to CGD's president, Masood Ahmed, to close us out.
Thank you very much, Megan. I've been listening and watching this fascinating conversation, and I'm really excited about the fact it seems to me we are really at an inflection point in this conversation. In a group of people who have been doing the research, who've been involved in championing that agenda, I think the evidence is already there, and you're beginning to see the return and on this investment in childcare, and also why it is such a big part of public and private policy priorities going forward. But we are now at the point where we have to go into convincing the finance ministers and the policymakers who are not every day engaged and as familiar with that agenda. And then the question becomes, how do we make that bridge? How do we, because from that will follow the policies and the funding to implement the ideas that are already on the table. And what I took away from this was clearly data is going to be a big part of that. And I think Nabil and others mentioned the importance of data. It's very clear that evaluations of what were
Have we lost Masood's audio? Just take a pause while we try to get that back. Sorry for the interruption, folks. Events team, any guidance? Should I take over?
Does that work now? Any better?
That's great.
Okay.
Sorry
about that technology. I don't know at what point you lost me, but what I was saying is that I think the issue, what is clear as to what needs to work is more data. And Nabila, you started us off by saying, look, how you need data to make the case better for finance ministers. Also, not just data, but evaluations of different models, because there are different models and what's working, what's not working. So Dave, you were talking about, the kind of research we need also needs to be well defined. So I would say that's another important dimension. And I think there's one other thing, which is partnerships across the community of people who are approaching this agenda with different skill sets and different networks. So it's the researchers, it's the advocacy groups, it's the champions that sit within the governments, including the unusual position that Nabila, you have, of actually sitting as a champion in the Ministry of Finance. And I think we need to bring together all of these, as well as the international financial institutions and the other advocacy groups that are involved in this agenda. So I would say partnership as well. So all in all, I think we're right at a point where we could shift this into a different level of not just analysis, but in terms of funding and policies. And that's the big challenge going forward. For us, CGD, big part of our agenda, obviously, but we will need to have partners to make it happen. So let me also just end by thanking all of you, the speakers today, for your terrific contributions. I do want to thank all the event organizers who were involved. Alba, who's been behind the scenes, very instrumental in making this work. Our events team. We've got an event producer, BNI, and also the IDB, the Inter-American Development Bank, and the Bernard Van Leer Foundation, who've been collaborating with us on this, as well as our funders for the work that we do on gender, the Bill and Melinda Gates Foundation, Hewlett Foundation, and Megan, you and Kehinde. I want to thank both of you for leading our work on not just this conference, but also on the program on gender or related work for CGD as a whole. So thanks for everyone for joining in. And I think this is the beginning of a conversation that we're going to continue over the years to come. Thank you, everyone.